The current state for predictive biomarkers for immunotherapy really consists of PD-L1. And we know that PD-L1 is a predictive biomarker, and I would say that it is a good predictive biomarker, but it's not great. Clearly, there are patients whose tumors express even high levels of PD-L1 that don't respond and don't benefit from anti-PD-1 antibodies. But the converse is unlikely to be true. That is to say that patients whose tumors do not express PD-L1, they do not seem to benefit from anti-PD-1 antibodies. So that's why I say it's a good biomarker, but it's not a great biomarker. Just in terms of the numbers, about 80 to 85% of patients with head and neck squamous cell carcinoma will express, their tumors will express PD-L1 at some level, and about 40% of those tumors will express PD-L1 at moderate to high levels. So we have a biomarker that we can begin to incorporate, and we should, into our use of anti-PD-1 antibodies. Having said that, where is the field going? And I think there are several directions that are being looked at. The first is other markers of an immune response to the tumor, and for instance, CD8 infiltration or other T cell subtypes, and other markers that indicate that the immune system has responded, such as gene set profiles. In terms of the tumor itself, we have looked at, and others have looked at, tumor mutational burden. And what we have to remember for head and neck squamous cell carcinoma is that it's a moderately mutated cancer for the most part. We see some patients with high TMB, above 10 and even occasionally above 16, but those are the exceptions. That constitutes only about 10% of the population. Most patients with head and neck cancers, their tumor mutational burden is going to be in the range of 5 to 7. So TMB can help us, but not tremendously. One thing that we've explored and others is a specific genetic loss, and that is of 9p, and even more specifically of 9p24. And we just published our work looking at the loss of 9p24 and the lack of responsiveness to immunotherapy. That seems to be true not only in head and neck squamous cell carcinoma, but in other solid tumors as well. That story continues to develop, but that may be another predictive biomarker that will help us in the near term. And then, of course, there are many other biomarkers that people are working on that are, let's say, much earlier in their development.